Time now for News Extra, brought to you by First State Bank, Scottsbluff, and Garrett. With our program, here's Kevin Mooney.
Thank you very much, Dennis. Good morning, everyone. We have Dr. Jason LaTowsky here from Regional West Medical Center. He's a general and bariatric surgeon, and we're going to talk about your weight and obesity, and that's a conversation I know a lot of people are thinking about here at the first of the year. A lot of people go on diets. They decide they're going to lose weight. They decide they're going to control things a little bit more after the first of the year. And I guess the biggest thing about weight loss and too much weight is just it's a big role in your overall health, isn't it?
It really is. It's one of the leading health concerns right now in the nation is obesity as a problem. It's almost overtaken smoking as a cause of preventable death. So it's really become a hot topic, and we thought this is a good time to bring out the awareness that obesity is a problem, that we have the modalities to help treat and manage that, surgical, medical, or even just dietary counseling available at the hospital.
All right. The dietary counseling, if somebody needed to come in and talk about that, it's probably due to maybe a diabetes diagnosis or something like that, or just too much weight, right?
It does go both ways. Most of our weight loss diets are very similar to a diabetic diet, where we're trying to cut out the carbohydrates, bring in better, good nutrition for the calories that you're getting and the volume that you're eating. It'll be the same dietitians that are managing both, and they're well versed, but it's not always associated with diabetes. There's plenty of people who are overweight who have not reached that point yet.
All right. Is part of the weight issue, is it portions, or is it the thing we eat, or is it a combination of both?
That's really been studied extensively, and there's no direct correlation that we're finding. It's a combination. Everyone's a little different, and it's really tailored to the person. There's no one diet or exercise or even surgery, for that matter, that works for everybody.
All right. Very good. So, say if somebody wants to talk to you guys, you have a gal there that talks about also medication options, right?
We do. We have Becky Bowman as addition to our staff. She's been there a little over a year. She's done a fantastic job with medical management. She's well versed in the surgeries and able to discuss those with patients who are interested that don't quite want to get in and talk to the surgeon.
Yeah. Do something else first, right?
Absolutely. Our goal is to get people healthy. Surgery does carry risks, so if we can get them to lose the weight with diet, exercise, or even medications and be successful, we're happy to go that route. I've had patients that come in for surgery and will start undergoing, our required dietary and exercise program. Most insurances require about 3 to 6 months. In that time, I've had patients that make a complete lifestyle change their diet, exercise, feel very satisfied and sustainable, and they never need surgery, and we consider that a win. We're helping them with the lowest risk option.
Yeah, lifestyle change rather than diet, right?
Yes, I am frequently said that a diet's a 4-letter word. You really need something sustainable if you want to sustain that weight loss. There are people who have put on a few extra pounds over the holiday that can go on a temporary diet to remove that. But people who chronically carry that extra weight need to do something more long-term to maintain that weight loss.
Yeah, no question about it. All right, we'll take a break and talk about some of the other options they have at the hospital right after this.
Now you can go paperless with e-statements. You save space as there's no need to file papers at your home or office. Go paperless. Make the change to e-statements. It's convenient and it's good for the environment. Think small, bank smart, go paperless. First State Bank, member FDIC. We're big on you.
We're just a small town community bank, but we're big on you.
All right, we're back on News Extra. We have Dr. Jason LaTowsky here, general and bariatric surgeon at Regional West Medical Center. We're talking about weight loss, obesity. We've talked about a number of options that the hospital offers in regards to helping you control your weight. And we've talked about the non-surgery options, which are medication, counseling, just trying to get people to change their lifestyle a little bit. if they can't get it done that way, there are other options, right?
Absolutely. Surgery has been very successful. It has been going on for a long time. We have procedures that are studied over 30 years with excellent long-term data. Our outcomes are very similar to, say, hip replacement surgery in regards to risks and benefits. But people have been very successful with surgery. It is something for people who have tried the diet, the exercise, and just been unable to sustain or maintain that weight loss.
Yeah. And explain how it works, really. Because there's several different types of surgery you can use, right?
Right. Really what we try and do is get people in, educate them about their surgical options. We want them to choose something that they're comfortable with, but we need to have them educated about what all the options are. There are certain times when one procedure may be better than another, and it's really sitting down one-on-one with the patient, reviewing their charts, what their expected weight loss is, and then some of their associated symptoms like diabetes or reflux or even smoking that may lead us to say one procedure would be better for them than the other.
Okay. You guys generally have a seminar every month where you go over some of the weight loss options that you've been talking about here?
Certainly. Dr. Holloway focuses on the bands, and he does a bariatric seminar in his clinic twice a month, and then I will do mine about 3 times a month in my clinic. The other thing that we offer is just a free seminar to the public. It's usually on a Wednesday evening about the 2nd or 3rd week of the month. That's advertised in the paper, and people can come, no obligations, and just hear about what our options are.
All right. If folks want to do that, want to talk to you guys, want to get involved in one of those seminars or clinics or something, how do they do that?
Our surgery clinic will be able to answer all those questions, or we actually have a bariatric coordinator now, Becca Latin. She's been very well versed on the different medications and surgical procedures, and she can kind of discuss with people over the phone and triage them into who they need to see, whether it's myself, Dr. Holloway, or even Becca, based on what their desires and goals are.
All right. What's your phone numbers up there? Do you have any idea? No? Okay. Just, you can check it out in the phone book. I think it's pretty easy to check it out. Just call Regional West Medical Center at 635-3711. Explain what you want, who you'd like to talk to. I'm sure they'll get you to the right folks.
Yeah, our surgery clinic is 632-2872. I don't have Becca's number as a...
632...
2872.
2872. There you go. There's a number for you that you can call. All right. Very good. Thanks, Doc. Appreciate you coming in.
Thank you.